There's a widespread and dangerous misconception that vitamins are inherently safe because they are essential nutrients. This belief often leads people to take high doses of vitamins without medical guidance, assuming that more is better, or that there's little risk in overshooting the recommended amount. However, the truth is that certain vitamins, especially fat-soluble ones like A, D, and E, along with high-dose niacin AB vitamin, can cause serious, and in rare cases fatal, toxicity when taken in excess. These overdoses don't only affect people with pre-existing conditions. They've occurred in otherwise healthy individuals who are simply following incorrect supplement advice, sometimes from unqualified sources. Fat-soluble vitamins are particularly risky because they accumulate in the body. Unlike water-soluble vitamins like C or most B vitamins, which are typically excreted in urine when consumed in excess, vitamins A, D, E, and K are stored in the liver and fatty tissues. This makes it easy for them to build up to toxic levels over time, especially if someone is taking multiple supplements that contain overlapping doses. Vitamin A toxicity, or hypervitaminosis A, is well documented. Acute overdose, such as consuming a large dose all at once, can cause nausea, headache, dizziness, blurred vision, and even intracranial pressure resembling a brain tumor. Chronic intake at high levels can lead to liver damage, bone thinning, and birth defects in pregnant women. In severe cases, especially in young children or those with underlying liver issues, high-dose vitamin A can cause liver failure or death. Tragically, some fatalities have occurred in populations using cod liver oil or high-dose multivitamins for extended periods. Vitamin D, though essential for bone health and immune function, becomes toxic when taken in high amounts over time. Excessive vitamin D raises calcium levels in the blood, hypercalcemia, which can lead to nausea, vomiting, kidney stones, calcification of soft tissues, and irreversible kidney damage. In the worst-case scenarios, this can result in cardiac arrhythmias, vascular damage, or death. Several case studies have documented fatal vitamin D toxicity in people who were unknowingly taking megadoses, sometimes due to mislabeled supplements or misinterpreted dosing instructions. Vitamin E, often marketed for its antioxidant properties, also poses danger in high doses. While less acutely toxic than A or D, long-term supplementation with large quantities has been linked to an increased risk of hemorrhagic stroke, especially when combined with blood thinners. In older adults or those with cardiovascular risk, excess vitamin E may actually raise the risk of death from all causes, according to some meta-analyses. Despite its reputation as a protective antioxidant, it may impair normal clotting and immune responses when taken above recommended levels. Niacin, vitamin B3, is another vitamin with a misleading safety profile. While it's effective at lowering LDL cholesterol and raising HDL, high doses, typically used in therapeutic supplements, can severely stress the liver. Niacin-induced hepatotoxicity can develop rapidly, especially with time-release formulas. Symptoms include fatigue, nausea, jaundice, and elevated liver enzymes, and in some cases, this progresses to full liver failure. Some deaths have occurred in patients using niacin as an over-the-counter alternative to statins without proper monitoring. Even moderate niacin intake in sensitive individuals can cause insulin resistance, peptic ulcers, and dangerous blood pressure changes. These examples reveal the deeper problem with supplement culture, the illusion that over-the-counter means harmless. Many users fail to realize that the distinction between a vitamin and a drug lies mostly in dose and context. At low doses, a vitamin may prevent a deficiency. At high doses, it may act like a pharmaceutical agent, but without the same oversight, warnings, or clinical supervision. Unfortunately, many supplements sold online or in stores contain amounts far exceeding daily recommended intakes, and few consumers calculate total intake across multivitamins, individual supplements, fortified foods, and beverages. Another concern is that symptoms of vitamin overdose often mimic other conditions and are easily misattributed. For instance, vitamin D toxicity may present as fatigue, confusion, and muscle weakness, symptoms that could be mistaken for stress or aging. Niacin-related liver inflammation might go unnoticed until it's severe. By the time overt symptoms appear, serious and sometimes irreversible damage may already be underway. To protect against overdose, it's essential to avoid megadosing unless under medical supervision. Check total intake from all sources, multivitamins, individual supplements, and fortified foods. Get regular blood work, especially if taking fat-soluble vitamins, high-dose niacin, or multiple products with overlapping ingredients. Consult a healthcare provider before using supplements for disease prevention or treatment. Be especially cautious with children, who are far more vulnerable to toxic doses due to their smaller body mass. Ultimately, the line between nutrition and toxicity is thinner than most people think. Supplements should never be taken casually, especially in high doses, and vitamins should be treated with the same respect and caution as pharmaceuticals. The goal is not just to avoid deficiency, but to prevent the very real harms that can come from excess.